So thank you very much to the organizers of the committee of this Congress. And yeah, I feel proud to be here, and I will try it without the microphone, because I think the room is small. No. Everybody can hear me? Thank you so much. Okay. I am here to get in contact to you with a lipedema surgery. So this is something I am specialized in. I'm a plastic surgeon, and my career was that I got into contact to a special technique, the water-assisted liposuction. And with that I found out that I am able to take out a lot of fat volume in a lower time, and I was able to treat a big surface of the body. And this is the best technique for me for the indication lipedema. And in Germany, where this technique was created, we have more than 10 years experience with that, and more than 1,000 operations of experience. And I want to share my experience with you with that technique and with that experience, because as a surgeon and as a patient, or everybody has the same question. When we think on lipedema surgery, what do we want to achieve, and what can we achieve? What is realistic? Yeah, and we all have the same goals. We all want first reduce the pain, or best way to take it away. We all want, with the surgeries, improve the movement. That means to take away the volume. And at least, of course, we want to improve the appearance, the aesthetic appearance. If a surgeon will tell you, I take you away 4 liters, which is the standard nowadays, yeah, in the worldwide liposuction, it is not worth it to do a liposuction with 4 liters on a 100 and something kilo patient. It is like a homeopathic treatment, and it's not worth to get the patient into a medical, in an operation, and we all know what an operation means. And I will tell you especially what this operation means. This is not just a liposuction, and it is not the same like an aesthetic procedure, where you just take a little bit away, or where you just treat a little surface of the body. No, it's a totally different thing, and I want to show you how it works in our clinic in Berlin. So please, can I see the first? Okay, in this video, it's demonstrated the method, water-assisted liposuction. What we do is we do incisions at the skin, and we go underneath with our cannula between the layer of the skin and the layer of the muscle. And it's important to understand that between in the fat layer, it's not just pure fat. That would be really easy to take away, just to take the fat out. No, we need to preserve the connecting fibers. And with the connecting fibers, you all know from the anatomy, there are the blood vessels with it. There are the nerves with it. And there's the lymphatic ways with it. So we don't want to destroy the layer between the skin and the muscle. We need a gentle technique. And please, can you put it again so you can see again how gentle in this technique it works. At the point of the cannula, water is coming out with pressure. And this pressure is hard enough to how do you say that in English? To take out the fat cells from the connecting fiber tissue. Yeah, it can free the fat cells and take it simultaneously, take it inside on another hole with suction. And so we have a simultaneous procedure by free these fat cells and take them away, yeah, without damaging or just with a little damaging of the connecting fibers. This is the point that makes this technique gentle. So this is a faster wound healing and less complications, and you can understand that. More than that, it is important to understand that we don't need to blow it up. You all know the technique of tumescence technique. Tumescence technique of liposuction means putting a lot of liquid in, the surgeon goes away for half an hour, taking the coffee, coming back, and then doing something. And doing something is not controlled. When we speak about lipedema surgery, we want to control what we do. We want to feel what we do. We want to see it immediately, because we have to do two sides with the same result. I need to be able to take the decision, when did I achieve the best result? When do I stop? Those are questions over questions over questions. It's not something, it's something you really need to be aware of. So let's see a patient. This is a typical daily picture from our clinic. When we do the operation, we cannot do the whole body in one operation. The body will not stand this. There are limits. We have to do in one surgery the lower legs and not more over the knees. We do in the next step the upper legs, not more. We do in a third step the arms, not more. The arms and the lower legs we always can treat in one surgery, because after that we can have a compression on it, we can bandage it, and the circulatory system will be stable. But the upper legs we never can do in one surgery. Oh, sorry, we can do it in one surgery within a certain limit. If the patient has a certain weight, and it depends on the volume you want to take out and the surface. But up on the, when the patient weight is more than 70 kilos, we also need to divide the upper leg operation in two parts. One the front side, one the back side. Here you can see it is already done the surface of the left leg. And here's just a little tumescence in, just a little. Also the water-assisted liposuction works with that fluid, but we don't blow it up. We just put a little tiny fluid in. This is because of the adrenaline. The adrenaline works in the vasoconstriction, and then we start immediately. And so here's the typical, you can see the typical lipedema lower leg in a lower stage, yeah, but this is how it works. This is how it looks. Yeah, like the difference when we lift up, the leg, and then we turn around the patient. We do the back side, closing the stitches, turning the patient back, putting on the flat knit garment. Yeah, to have a perfect individual compression on the legs directly after operation. It is important for safety to know the limits. My experience is 10% of the body weight in liters. That means when I have a patient from like 100 kilo, we are able to take out 10 liters of pure fat. 10 liters. Up on the 10 liters, the complication rate is rising. So we are standardized and really specialized in that awareness that when we come to this point in the OR, it's a team decision. We all know, yeah, we have to know what about the blood level, the hemoglobin. How is the fat coming out? Is that soft? Is that without bleeding? What are the circumstances of the patient? Is he under good conditions? How was the circulatory system after the first surgery? What is the operation time? And I asked the anesthesiology, are we still safe? Yeah, we are. And then when that all comes together, we go up to those 10%. But we don't go over that. This is our personal experience. There's no scientific research. But what we do not is to stop with 4 liters. We don't stop with 4 liters because that doesn't make sense. Then the operation is not ready. The operation is ready when we got treated the whole distribution of the lipedema. And we know it begins from the ankles till the hips and from the wrist till the shoulders. And this is what we treat. We do it all the way around. We do it. Sorry, I'll go back to this important picture. You can see how here's already treated the lower legs, and then this lady with that huge amount of fat, of course, needs a splitting of the upper legs. So those are two operations. And in this operation of the front now, it's the front of the upper legs. Yeah. So it's a volume coming out from like 10 liters. Each bag here contains 3 liters. And here you see the pure fat, the yellow one, and this is not the pure blood below, but it's the water we are working with. It's the water going around, washing out the blood cells, and of course washing out the fat cells, and of course some blood cells come out. And if you come in the operation to a situation where you have less volume of fat and more blood, yeah, you are limited in the surface you can treat. This is another lady where I wanted to show you that it is also possible just to get out of the lower legs. Look at the lower legs, you see the typical distribution of lipedema. It's not a lymphedema. It is inside the cells, you know. So because here we have all the signs of lipedema. I don't need to repeat that in an advanced stage, and the fat inside the body is under pressure. And when we freeze it, when we let it out, it looks bigger. It's bigger. It's destroyed, and it's in the water, and looking like a lot of volume. And this is also here in this picture. We can see that I took out 10 liters just of the lower legs. 10 liters of fat just out of the lower legs. And why is that? Yeah, why is that? I had to take out 10 liters of the lower legs because this is the only style. This is my personally, I'm convinced that's the only style that makes sense, because I want to achieve the best result possible. And to achieve the best result possible means you know when to stop. To stop means you have the perfect layer left, the perfect layer of fat. That makes sense. If you leave too much, you leave lipedema. And we all know lipedema can regrow. We do hormonal change with this operation. This is the trigger for the rest of the cells, maybe to get bigger. And we don't want the patient to come back after a year telling us we have pain again. We need another operation. No, we want to make it ready, ready in one operation of each step of those operations. And there needs to stay a certain layer of fat because of the function. Fat has a function. We cannot take it all away. It has a function of keeping the warmness and for aesthetic reason, for the appearance, for protection. And so the question is, what is the perfect layer? This is something you need to control. You want to see. You want to feel. You want to take the decision. This is for this individual person the best result. Yeah, and with that we are able to do like mega liposuctions, just with the lower legs. And again, then we do the upper legs up on a certain weight. We split the upper legs in one operation front part and one operation the back part. And then we do the arms. The arms is another operation. And yes, we go till the wrist because we want to take away the whole distribution of the lipedema. That makes sense. Otherwise, we would create like holes. If you just do a liposuction of the in the brachioplasty area of the upper arms, you didn't solve the problem. You did not. So the patient will come back again and will stay with pain. So we do it circular. And yeah, I'm almost ready. And this is what I want to tell you. It's not just a liposuction. We do it in a circular way, all the way around. 360 degrees. Over the legs and over the arms. We create huge wound areas. And we take out a lot of volume. For this, you need a gentle technique, you need a lot of experience, and you need to know the limits for not bringing the patient in a medical dangerous situation. Yeah, this is important to know. I miss a picture. Okay, so this is the really short 10-minute speech with the take-home message. Lipedema surgery. Yeah, we want to take the pain away. We want to improve the mobility, and we want to achieve a good appearance. So let's use the last 2 minutes for questions. I really made it short, so that if we have the chance, if there's like an urgent question, we can deal it here or not.
Sure, we will have questions.